presentation is about a patient with chronic bronchitis for the NUR 2106 Integrated Nursing. I'm Tinatri.
I'm Ujara.
I'm Delene.
I'm Sneha. So please enjoy the video. Okay, our case study is about Mr. Bobby, who is a self-ambulant 56-year-old Chinese male who stays with his wife and son. And he was brought to EDY ambulance for his shortness of breath, persistent fever for 5 days in a week, and fatigue. He has got a past medical history of acute bronchitis with no known drug allergies. This is his third admission in the hospital in the past year, and he's got a maid as his main caregiver for both him and his wife. Also, he's a chronic smoker for 36 years, non-alcoholic, retired factory worker for 3 years. In his initial assessment, he was lethargic and in distress, increased wake of breathing with use of accessory muscles, and also seen having dyspnea with ashen coloration with frequent productive course for more than 3 months. His baseline vital signs are as shown as this picture. So he was presenting with tachypnea, pyrexia, and low oxygen saturation levels of 86% on room air. So a physical lung assessment was also performed on him. So in inspection, barrel chest, dyspnea, and productive cough were identified, while palpation decreased bilateral pulmonary expansion was identified. Hyperresonant were in percussion, and bronchi wheezing and chorus crackles could hear in auscultation. So these are the investigations that we performed on Mr. Bobby, but we're going to be focusing on abnormal investigation, which are in full blood count. It says elevated white blood cells, hemoglobin and hematocrit, decreased pH levels, and increase in partial pressure carbon dioxide levels in arterial blood gas. In respiratory function tests, it was less than 70% of FEE, FEV, and FES, and also you can see a barrel chest in his chest X-ray. Also in the sputum examination, the sputum was thick, greenish, and tested for gram-positive bacteria, which is Streptococcus aureus. The definition of chronic bronchitis is defined as the presence of cough and sputum production for at least 3 months in each of 2 consecutive years. Sputum production begins when inflammation and swelling of the lining of the airways begins, which lead into narrowing, that obstructing of the airways, and resulting in daily cough. So as you can see in the picture, you can see the difference between a healthy and inflamed bronchiole. There are several clinical manifestations that contribute to chronic bronchitis, but according to Mr. Bobby's case scenario, there are major clinical symptoms that can relate to his condition. So firstly, presence of chronic cough and producing sputum, which can vary from patient to patient, and also due to his diagnosis, which is a bacterial infection, his sputum could be greenish or yellowish. And secondly, increased shortness of breath or dyspnea on exertion, wheezing, fatigue, headaches, weight loss due to dyspnea, which could interfere with his eating or work of breathing. Also, presence of cyanosis, which can be bluish or ashen skin coloration, fever, and also mucus hypersecretion. Although there are several risk factors contributing to chronic bronchitis, cigarette smoking is the major risk factor to contributing to Mr. Bobby's condition, because he's a chronic smoker for 36 years and he uses 2 packets of cigarettes per day. Also exposure to passive smoking and increased age, because he's above 45 years old. Also, another major risk factor would be repeated exposure to pollutants such as dust, chemical fumes, because it is evident that he was a factory worker for 3 years. And Also, there are some other risk factors such as indoor and outdoor air pollution, genetic abnormalities, repeated hospitalization, and other risk factors such as some infection, poor nutrition, and coexisting disease processes. The complications of chronic bronchitis are respiratory acidosis, acute exacerbation of chronic bronchitis, pulmonary hypertension, cardiac enlargement, and more importantly leads to right-sided heart failure. So I'm going to pass the next slide to Dylan.
Today I'll be discussing with you guys the pathophysiology of chronic bronchitis. So the healthy balance of a normal process in the lungs, also known as pulmonary homeostasis, can be listed by external environmental factors or endogenous factors that has been mentioned in the risk factor slides that has been presented by my groupmate Udara. So in response to these insults, the lung actually responds with protective mechanism, also known as inflammation. So chronic bronchitis is the progression of narrowing of the airway that ultimately leads to airway obstruction. So three components actually leads to narrowing of the airway in chronic bronchitis, and those would be fibrosis, smooth muscle contraction or increase in smooth muscle tone, and mucus secretions. So as according to the flowchart, with inflammation it leads to triggering of cytokines, which basically are proteins that maintain pulmonary homeostasis. They control immunoresponse to injuries or infection, resulting in clearance of insult, which ultimately leads to repairment of lung tissue with extracellular matrix. So as with the disease progression from acute bronchitis to chronic bronchitis as seen in Mr. Bobby, injuries are repetitive and severe, which leads to dysregulation of cytokines and inflammatory repair response to be over-exuberant. So excess accumulation of extracellular matrix leads to fibrosis with time, resulting in decreased elasticity and increased thickness of the bronchial walls, and which narrows the airway. So clinical presentations for this will be seen as increased work of breathing and shortness of breath. So inflammation can lead to increase in smooth muscles in the bronchioles, which can lead to functional bronchial construction via increase in muscle tone, hence increasing thickness of the airway wall. It can also lead to lower the FEV1 as seen in the respiratory function test results, which causes increased resistance in the airway. With that, a decrease in airway occurs, which hence causing Mr. Bobby to be ashen in color with a decreased SpO2 despite having increased respiration rate. This is because the lung is unable to meet the body's oxygen demands. So under normal physiological conditions, epithelial surface of the bronchial airways, which consists of mucus-secreting goblet cells, exerts a protective mucus layer. Mucus layers acts as an entrapment and transportation of inhaled irritants, particles, and microorganisms. An increase in the number of goblet cells can lead to would be as in response to the respiratory insults, resulting in an increase in the output of mucus. This leads to intraluminal mucus accumulation, which clogs and blocks the airway. So the clinical presentation of this will be a productive cough as seen in Mr. Bobby. Okay, so today I'll also be telling you guys about the 4 medications that we have chosen for this case study in relation to management of chronic bronchitis. Upon vital signs assessment, it has been found that Mr. Bobby is having a fever of 38.3 degrees Celsius. So we'll be giving her antipyretic, which we have picked paracetamol for, which acts by inhibiting the hypothalamic heat regulating center. So it's contraindicated in people who are allergic to paracetamol and also with diminished liver function. So the dosage will be a tablet of 0.5 grams to 1 grams every 4 to 6 hourly with a maximum dose of 4 grams per day. There are no common side effects for paracetamol, however there are adverse side effects which will include liver failure. So if administered more than 4 grams a day, hepatotoxicity might happen, and signs and symptoms of that would be nausea and vomiting and delirium. Okay, the nursing interventions for paracetamol will include monitoring of liver function. This is because medication can cause increased risk of hepatotoxicity. Proper documentations of medication administration, as paracetamol should not be given less than 4 hours from the previous dose. Monitor fluid balance chart, as nausea and vomiting are first signs of hepatotoxicity. to monitor the Glasgow Coma scales, as delirium could happen, so this would allow the nurses to gauge changes in mental state, and to monitor the vital signs, especially blood pressure, as hypertension is a side effect. So I'll be passing on my slides to Sneha, who will tell you more about the rest of the medication.
Okay, so the next medication we'll be focusing on is an antibiotic known as moxifloxacin. It's a broad-spectrum antibiotic which is proven to be more effective towards gram-positive bacteria such as Staphylococcus aureus, which Bobby's sputum test was presented positive for. So how it works is it inhibits the DNA gyrase, which is an enzyme, and this antibiotics works by killing the bacteria that's causing the bacterial infection. So it is contraindicated to known allergic towards moxifloxacin or any other quinolines, and the dose will be given through an IV line, and it should be administered via slow infusion rate for a period over 60 minutes. And side effects we'll be focusing on will be oral thrush, diarrhea, and nausea and vomiting, and adverse side effects will be diarrhea for several weeks and pain and swelling of the tendon. Okay, so next I'll be talking about nursing interventions. So first of which will be a risk of fall due to side effects such as lightheadedness and dizziness. By that we can implement 4 risk precautions such as make sure the floor is clean at all times and dry. So next will be monitor fluid balance charts, as this medication can increase the level of liver inflammation, so which the possible side effects will be nausea and vomiting. Next, we perform regular ECG after commencement of medications, as this medication has an effect of ECG rhythms. So it's good to let the doctors know if you're on medications that can increase your heart rate. So this medication actually increases the risk of QT intervals prolongation. So the next will be encourage patients to perform oral and regular oral care. This will minimize the risk for oral thrush. Fifth one will be regular pain assessment, as this medication increases the risk of tendon damage. And last but not least, we will monitor WBC levels, because patients' current WBC is elevated and this medication might suppress it, so it's good to check the effectiveness of the antibiotic. Okay, so the next medication we'll be focusing on is salbutamol. So the indication for this medication will be chronic bronchitis. So how does this medication work? So basically, it stimulates beta-2 agonist receptors, which is the predominant receptors for bronchial smooth muscles in the lungs. So how it helps is it actually relaxes the bronchial smooth muscles, which in the end actually opens up the airway so the patient can breathe. So the contraindication for this medication will be known allergy to salbutamol or any 2 beta agonist medications. The dose will be given via nebulizer, so it's like 2.5 to 4.5 mg up to 4 times a day, and the side effects will be focusing mainly on tachycardia, drowsiness, and dry mouth. And also the adverse side effects will be chest pain, hypertension, hypoglycemia, and hypokalemia. Okay, so for nursing interventions, first we'll be monitoring the vital signs, especially BP, because since this medication has vasodilatory effects, it will actually decrease the BP and increase the heart rate. The second will be monitoring the electrolyte levels such as potassium, because patient is at risk for hypokalemia. Third will be monitor glucose level, because this medication increases the insulin level. The fourth will be encouraging patient to rinse the mouth after nebulizer. This is to minimize oral thrush. And fifth will be monitoring the fluid balance charts, because the side effects will be nausea and vomiting. Sixth interventions will be rinse of the nebulizer after each use, because this is to ensure that any residual medication is removed from the canister. So last intervention will be record the date and time of Ventolin opening, because 3 months after the opening the medication can't be used, and or as per hospital protocol. Okay, so the last medication our group will be focusing on is acetylcysteine. So the indication will be predominantly used for people with wet cough and chronic bronchitis, which Bobby is experiencing. So how it works is it exerts mucolytic action through sulfhydryl groups, which opens the disulfide bonds in the mucoproteins, which then helps in the lowering of viscosity and elasticity of the drug. So it is contraindicated for patients who are allergic to acetylcysteine. And this medication is an effervescent tablet, so it's supposed to be consumed per orally at 600 mg at a single dose, or 200 mg with 3 times. So the side effects will be tachycardia, hypokalemia, nausea or vomiting, and hypo or hypertension. And the adverse side effects will be angioedema, liver function disturbances, or convulsions and seizures. Okay, so in regards to nursing intervention, first we'll monitor the fluid balance chart, because it can cause nausea and vomiting. Second will be monitoring the vital signs, especially BP, because this medication can cause hypo or hypertension. Third is to ensure that the medication is kept within the packaging and it's away from moist environments because it is an effervescent tablet. So this is to prevent oxidation and the dissolving of the medication. So lastly, we'll monitor the electrolyte levels for such as potassium. This is to prevent hypokalemia. So next, I'll be passing on the slides to Tinashi to talk to you more about the general nursing interventions.
Okay, we're administering 4 liters of oxygen via nasal cannula to improve the airflow into the lungs. The rationale behind doing this is to increase the oxygen intake by the cells of the body, and we provide humidification with oxygen to provide moisture to keep the nasal passage from drying up. And we're positioning the patient in a semi-fowler position or in a tripod position. So the tripod position is positioning the arms across the chest and leaning forward so that it allows a better lung expansion. So we encourage the patient to cough up sputum, which clears the airway and basically improves the airflow absorbency of oxygen into the body. And we monitor vital signs and do physical lung examinations to monitor any improvements or any decline in the patient's lungs. So another goal is to reduce the body temperature so that the patient's body temperature is within normal ranges. So a nursing intervention for the goal is to administer medications timely, antipyretics, and monitor vital signs regularly, and also the application of the cold compress to minimize the core temperature of the body. And we would encourage the patient to wear thin clothing because thick clothing will increase the body temperature. So the next goal is to reduce complications related to the IV side of the patient because we are delivering IV antibiotics. So we would assess the IV side at the start of every shift and at delivery of each medication. And we would look for signs of infection and inflammation around the IV site. We would also maintain a septic technique to minimize the risk of infection so that to prevent the microorganisms from getting into the body and into the site. We would mark the IV site and the tubing, and we would also date and time it to make sure that the IV cannula is taken off within 3 days or as according to the protocols of the hospital. Also, we would make sure that the delivery of the IV antibiotics is according to prescribed to minimize any irritation of the vein. So when dealing with the case with Mr. Bobby, we would use collaborative management with a few healthcare professionals to gain the optimum goal. So we have a physiotherapist for pulmonary rehabilitation to teach the effective breathing techniques, a dietitian to make sure he gets a balanced diet, a radiographer to evaluate the lungs, medical imaging of the lungs, and a medical social worker to provide financial support and deal with the financial aspect of it, and occupational therapists to identify any hazardous places he will encounter in his day-to-day life, especially in his home, pharmacist for the explanation of medications and to educate the patient regarding the technique and side effects and how to deal with medications, and the doctor who is the case manager to manage chronic bronchitis and to minimize exacerbation.
This is our references. Thank you so much for watching.